Hi, my name is Kristen Fletcher, and this is my oral competency on blood flow through the heart. I'm going to bring my poster closer so that I can point out things as I go. So here I've drawn a simplified heart to help better show blood flow through the heart. So starting out, deoxygenated blood is received from the body through the superior vena cava and the inferior vena cava, as well as the coronary sinus and the cardiac arteries, which aren't drawn here in this picture. So as blood comes from the body, it passes through from these veins into the right atrium, seen here in pink. From the right atrium, blood passes through the tricuspid valve, which is located between the right atrium and the right ventricle. Through that valve, the blood enters into the right ventricle. At this point, blood is still deoxygenated, so it's going to pass through the pulmonary semilunar valves into the pulmonary trunk, which splits into the pulmonary arteries, which take blood to the lungs. In the lungs, gas exchange occurs and blood is oxygenated once again. So, oxygenated blood comes in through the pulmonary veins into the left atrium. From the left atrium, blood passes through the mitral valve, which is also the bicuspid valve, into the left ventricle, seen here in yellow. From the left ventricle, blood is pushed through the aortic semilunar valves into the aorta, which breaks into many vessels that carry blood throughout the body. From the aorta, blood is also supplied to the heart through the coronary arteries, and then from there, blood goes through the body and through the heart, of course, and when blood begins to become deoxygenated again, it is returned to the heart through, again, the superior vena cava and inferior vena cava, the cardiac veins and sinus, and the coronary sinus, and the process begins again. So for this particular demonstration, I show blood in one movement, but in real life, each side is contracting simultaneously to constantly pump blood. So it's not like blood comes here and then here. No, blood is always here, going here. Blood is always here, going here. It's an ongoing process that keeps the blood oxygenated that goes to the tissues and keeps deoxygenated blood going to the lungs to get oxygenated to go to the body, as well as the heart. And this concludes my presentation on blood flow through the heart.